So let me start my screen. Okay, let's say this one.
Down.
Okay, can you see that?
Yeah, we can see it. Make it slide so.
Yeah. Okay. Yeah. So thank you very much. It's nice to come back to somehow in a virtual form to JNU, and every time I get a chance, I come with a cup of tea because I was there in long back, 20 years back. And so thanks for invitation to old friends. And I'm going to discuss about what is going in the vaccine market. A lot of people have discussed the drug market. I mean, market in the way that if the vaccine is available, then only somebody will be treated. And why it is required? Because vaccine is a first line of defense. So a healthy person will get it, and so that they'll be not getting disorder and disease. And then there is a second line of defense. When I'm infected, I will get medicine. Yeah, so both are required at the same time. And one is vaccine is a first line of defense. So let me discuss. Actually, I was not working on coronavirus before this pandemic, and I have my own areas of research, and I was literally going with those areas, and I just started my laboratory in Bangalore. And so as COVID-19 came, it thrashed us like anything. So we put us into the houses. It's put us into the news to make a new strategies, how offices will run, how PhDs will work. And that time it hit us, most of us, very hard, right? And at that time I realized, okay, I had a long-term vision that I will start at someday working on viruses. I'll always discuss and I somehow not start. And that's when we were coronarized, and coronavirus has infected us in a way that I have started working. And I will give you what we are doing and what is the status of vaccines today on coronavirus. So many of you know there is a lot of controversies going on, and so this picture, actually, this is the wild wet market where the wild animals are sold. One of this, it's assumed that one of these is animal, probably bat or antiteros, and wolf probably was carrying this virus, and which came to us. So there is a lot of controversy, but this is Zhang and Holmes, who are pioneer on the coronavirus and viruses, put it into cell. And so this market from which in Wuhan this current virus has spread. And so this is not the first time that virus has spread to human. And this virus has a tendency to spread again and again. So the coronaviruses are of 4 classes, as you see, alpha, beta, gamma, delta. And what we see here is that the alpha viruses and the beta viruses transmit through bats or through a bird or some animal, intermediate animal, to human. Gamma and delta are not yet noticed, but they are also infecting other mammals. So these are 7 viruses listed here, and 3 of them were very, very dangerous. And SARS-CoV-2, indeed, we are facing it for the first time, that massive lockdown and blockdown, you can say whatever you want to name it. And that suggests that, and there are a lot of literature available from 2003 onwards, which was hinting that there will be another virus coming up. And so if the 8th one is coming in next 7-8 years, it will be not surprising for me. And so why it was not put up into attention, I don't know. But vaccine efforts were slower once the SARS, MERS were knocked out, and it should not be happen. And then secondly, our approach towards going and mingle with wild animals should be also be must be also be controlled. So we should not be get so wild into wild with the wild animals, and we also have to do not entertain city markets with a wild animal cell, and that's very strong point one has to take on those issues, because it will be infecting. And if you are living in India and you are coming in from a village side, people will be worried about if you are going out in wild or catching a wild cat. So probably this is the reason why they were worried about, because you will be get sick by some sort of viruses. And that's one has to believe what people were saying. So from layman perspective, you have to always protect yourself from unknown infection. And so when SARS-CoV-2 caused this pandemic, the genome of SARS-CoV-2 came in, and there was a very small genome, 29.8 kb in size, and with 14 gene and encode for 27 peptides. And the major peptides was a structural peptide, a spike protein, envelope protein, membrane protein, and nucleocapsid protein towards 3' end of the or end of the genome. And the 67% of the genome is a large in gene, which is encoding for a very massive peptide, which will break into smaller units, and these units will be then form smaller peptides that will required for the virus to when virus is inside the body, it will these proteins will be helping the virus. And so this is the bottom part of this, showing how it is probably evolved on a phylogenetic scale. And of course, this we already know there are 4 classes of viruses, and so similar trend is followed. And so once the virus is infecting, what kind of vaccines are possible? Yeah, of course, there are several kind of so one is that you take a little amount of live attenuated virus, and is injected in your human body, and you will get vaccinated. Another one is that you take a whole inactivated virus. So virus is inactivated, means a dead virus. And then you can take a recombinant bacterial vector, where you can add some of the viral DNA. Then viral vectors, and then either you can take a spike protein or envelope protein or surface spike protein. Obviously is the most commonly used, and because with the spike the entry is actually happening, so the spike protein is used. And then you can use nucleic acid based uh, vaccines. And then you can take a small portion of the protein and synthesize in locally in the lab with this homology, a motif or so, and then that one you can pull inside your synthesize in a large amount and give injection or to healthy person, and that will be having. But that is synthetic peptide has to be very unique, and it should not match to the human known in a human genome. And so in my group started working with these kind of effort, that we broke the entire genome of the SARS coronavirus into very small pieces, and start searching for the small pieces if they have a match in human genome or a human proteins. And we could say that the matches are very rare, and only for a few peptides, a few minor stretches of 25 amino acids or so. Other than that, it's not matching with the human genome. And let me I'll show you what we have done. So the clinical developmental stages are in primarily, most of you know, and those who don't know, I'll explain briefly. Preclinical trial will happen on the you have a vaccine, you will not directly put in a human body, right? You don't want me to die, or somebody else. The human life is valuable, and so we'll have a testing, and even animal life is valuable. Yeah. So, but you will have a model organism, so which like a mice or uh, mm, uh, monkey here, and then you test, put this, give them a vaccine to check the how safe or unsafe this medicine, this vaccine is, and then you will also check the how much, what is the amount is required, if there is some side effect or not. And once you do that, you will have end up about 70% of this first preclinical trial, 70% of the vaccines will pass through. And then you will go to second round with a fewer number of human volunteers. Suppose I am ready to volunteer my life, you one can test it, 6 or 10 or a very smaller number. You will test this vaccine, how effective it is, and also to get a rough idea how much dose is required. If you overdose, what happens? You may be healthy, but maybe you're getting fatter, or maybe some sort of side effects. People will try to estimate, and then extend the same trial if this is successful. At this stage, out of, if you start with 100, out of 100, 70%, 70 will go for the second round, and for second round to third round, only out of 70, 33% of 70 will go. So it's approximately 21 or 24 will go there. And then you, when you extend this further on some thousand of in phase 2 trial, it will be again passing 30%. So it's like 21, then about 9 or 10 will pass through to third phase, and out of 9 or 10, only few will be going for approval if you're lucky. And so there are viruses where vaccine is not yet approved, and and the approval is actually, you can put it to American authority, FDA, ICMR, World Health Organization. And for in this case, if we want to have a rapid one, we will have to do a global team setup. Like experts will globally discuss. Like, let's have one team which will finalize the list rather than country-wise. 200 countries will do it. So that's how the vaccines are normally being developed, and that's where we need. So it's like 4 years to 10 years time normally, if you normal speed if you go. But then in a pandemic era, you cannot go like that, right? So you cannot wait for next 10 years. I don't want to die. So most of the people realize it and importance of it, and then they want to switch phase 1, phase 2, and phase 3 trials, so that they can come up with the vaccine in next 12 to 18 months. And of course, there are a lot of article on it, and you can read this commentary in New Journal of England. And so so then what is the current status actually? So over about 150, 140, 150 vaccine trials are going on, and a preclinical trial is somewhere 126, and it's every day changing. So you can go to WHO website and another website I will mention you next slide. There also, and so there are preclinical trial are on for about 126 of them, and star is because maybe while I'm talking, 2 more have been added to that. And then 7 are in phase 1, and then 7 more in phase 2, and 2 are in the phase 3 trial, and none of them is approved. So that's most of us are aware. And anything which will take about 12 months from now here on, about 10 or 12 months, even if you're faster. And so I'm giving you a list here, and list is that mRNA based two companies or 2 alliances are actually developing mRNA based vaccine in phase 1, phase 2 trial. One is German company, and obviously Moderna, you already know. If you are knowing that whose share was going up during the world was going down, Moderna's share was going up because they possibly thinking that they are ahead. And then then there is a DNA vaccine, and then a viral vector based vaccines and inactivated vaccines, and so on. And there are some Chinese vaccines where we are not knowing what Chinese are actually producing, and that's world is not able to negotiate with China that let's be open what you are doing, to at least instead of saying unnamed, some name has to be there, and obviously privacy will be there when the vaccine is there. So I have worked with a drug development from scratch, and I know how much privacy is kept. And then in phase 3 trial, we have this AstraZeneca Oxford-based adenovirus-based vaccine, which is in phase 3. And then 2 days back, this was only one, but then this another one, which is uh, older tuberculosis vaccine, is tested in the Australian Institute, and that is under phase 3 trial as well. And then it's every day changing, so you can check it at the WHO website. And also I have given a link for New York Times, which has a daily update tracker, and I have shortened it for you, tiny URL, that COV 2020 vaccines, so that you can go and track it. And while we were doing that, our team was also thinking, and you'll ask, why so many attempts? Because now at the end, you want at least 1 or 3 to be successful, and therefore let people make 1,000 attempts. So this is what else in life one can do today, right? So because you cannot go cinema, you cannot do much of your coffee shop also, you have to go hiddenly. So let's see what we were doing when the offices were closed. We cannot go. I was sitting almost from March in this room, and but I cannot sleep because I have a habit of working. Yeah. Uh, so what we did was we started looking on the nucleocapsid protein and other proteins, and we set up some team. It was very hard to set up teams. And what we see here, that again, the nucleocapsid protein is at the very end of the genome, and say not human genome, but coronavirus genome. It's the Chinese one on the standard, and then human samples were added to it. And then what we noticed, that this protein can be divided into domains which are intrinsically disorder domain in the 5' and 3' end, and then they have N-terminal domain, C-terminal domain required for RNA binding and RNA binding plus dimerization. And what we noticed, they could identify 7 motifs and also nuclear localization signal, So we were working from different aspects. So at the same time, what are all we can get from the scratch classical sequence analysis and a structural analysis, straightforward. And so we identified 7 motifs and nuclear localization signal. And I can show you some example why these are important. So there's 7 motifs. I'm not going into details. So 7 motifs at different locations. And this paper is available in preprint. You can have a look. So basically, if you have this is 100% conserved across all coronaviruses. So I'm calling other viruses, that is other members of coronaviridae. And this motif is can be easily mapped, is mapped to all the viruses. So if you are looking for a coronaviridae specific a specific antigen, you have to target this, because this can be artificially synthesized synthetic peptide we can generate, and this can be very critical. And this is what we assume, and there are a lot of steps afterwards. It's not straightforward. Forward, we have to see the other steps as well. So but this one we propose. And then some of you may argue, okay, so there can be can you find something which is SARS-CoV-2 specific? And so indeed we identified a motif which is SARS-CoV-2 specific, which is also a nuclear localization signal and nuclear export signal, indeed. And that one is not found in other viruses, as you see down. So small motif, but again, if we have 2 motif from one protein which is previously not identifiable. And so taking advantage of genomic sequences we have identified, and we postulate that these 2 could be very useful for artificial synthesized peptides. And since the frame is very short, I want to make you again a point that last time in 2003 and 4, or even for March, so vaccine were not in the market, and which Professor Anand has already made the comment. So similar comment I have, that never stop when you are developing a vaccine. You can slow down. You can maybe from 20 companies, may let 5 companies or let 5 research or 10 research group per company still keep on working, because the one can repurpose it for next pandemic like situation, or even smaller level disorder if it's coming from coronavirus. So therefore, even if the coronavirus mutates and start behaving without you do anything, it's a humble request to the scientific community and and also to the funding agencies that never stop this, because you see in the phase 3 at the moment, there is a one which is a repurposed vaccine is in the trial 3. So advantage of repurpose is that it will save it's like a failed coach. Failed cricketers turned out to be very good coaches. Yeah. So failed in one exam doesn't mean failed in the life. So same way you can take a philosophically that a failed vaccine can be also be very successful to a next pandemic or a next. Even now I heard that in India is trying the polio virus vaccine. Yeah. So which is was against polio virus. So you have to think that science is not a rapid it's not like that I'm going to kitchen and I'm making chicken curry, and it's like it will take over years. And I have spent several years of my life, and every time I wanted to quit, could not quit because I liked it. So it's you have to uh, pinpoint yourself that it will take time, but if you are focusing on the developmental aspect, it's not just that okay, I understand this today is the rapid requirement, but even if there is not a rapid requirement, R&D must move on and to a slightly. So that's a very strong comment for everyone to understand. And our my team is actually bottom one is my team, but as the pandemic emerges, the team vanished. Only one person from the team could make it up to the COVID-19 volunteers list, and so we had to make a new team, and a totally new team. A new team is working from same room somewhere. Somebody is sitting in Germany, somebody is sitting in Hungary, and somebody is sitting in the Calcutta. So a very senior scientist, Tamogna Mitra, has joined my team as epidemiologist, and Dr. Parveen from Germany, and several other PhD students and master students have joined hand with me during the pandemic. And I request you, if you can do it, and something you can do it during the period, and do not vanish like the bottom team. And some of them bottom teams are not just vanished; they are also working. And also, I would like to thank DBT for Ramalinga Swami Fellowship. And if I was not there, I would have not been here and talking to you. And then Institute of Bioinformatics for their wonderful support. The support provided by Manipal University, formerly called, now it's called Mahe, and also uh, uh, the Spanish company called BioBam. They have provided their subscription for genome analysis software and the server for free to us to analyze during pandemic. And we thank everybody, and we thank you also to listening. And if somebody want to connect, they have the website, they have my email address, and even my mobile number is given there. So basically, you can connect to me, and if you want to work, we have several things going on, and every day and every morning we have some new news, and we were keep on sharing on other talks, and you probably can be part of. It's a bigger opportunity. It's a bigger opportunity because a doctor in hospital is treating a lot of people, and as a scientist we have very less opportunities in a life where can make impact directly to the public, right? So if one of our synthetic peptide is working, we will be making that impact, and indirect impact we do make time to time. Obviously, research articles we publish, we are all incremental in science, but this is the moment when if we can manage, it's worth managing, and it will have a very positive impact on your career. As in 20s, if I was in 20s, I would have definitely been working by associating with groups. And there are a lot of groups we are looking for volunteers, not just my group. And we are computationally, very simple tasks has to be performed. And but we need people. Yeah, so we request you, if you have a person who has a interest, please join our team, and we will be giving you a good project to work on. So I thank organizations again. Thank you very much. And yeah, I do not have any slide actually.